Welcome everyone. Today I will be explaining on the journey to explore the relationship between cannabis use and the mental health disorders. Let's dive into this process of uncovering the highest level of evidence on this crucial topic. First, let's make our question for our topic using the PICO method. PICO. What does PICO stand for? P stands for population, I for intervention, C for comparison, and lastly, O for outcomes. In P, this refers to the groups of individuals you are interested in studying. In this case, the population is the individuals who are using cannabis. Interventions. This is the exposure of treatment being investigated. Here, the investigation is cannabis users. Comparison is the group that will be compared to the intervention group. In this case, the comparison group consists of non-users or light use of cannabis. Lastly, in outcomes, this is the result of effect you are investigated to observe. The outcome in this case is the risk of developing a mental health disorder. Now, we can choose these databases for their comprehensive coverage of our medical and psychological literature, offering a holistic view of our topic. What I chose was SNUG and PubMed. In SNUG, this is a place to easily start for nursing and allied healthcare researchers. PubMed has comprehensive coverage of biomedical literature as well as easy access to Aboriginal and Torres Strait Islander health literature on this database. How can you find these databases? You can go to the University of Wollongong library page and head to A to Z databases and select on C for senile database and M for Medline database. In individuals using cannabis, does the frequency and duration of use correlate with the increased risk of developing mental health disorders compared to non-users? Our clinical question formulating using the PICO format serves as our compass in this quest for finding evidence. Now, let's see our search strategies. We can use cannabis use, marijuana, mental health, psychiatric disorders, and risk factors. We meticulously selected these terms to cast a wide net while ensuring relevancy. Now, I'll first use senile. Let's put them in and search. Wow, a hefty number indeed. Next, what we can do is we refined our search to minimize the irrelevant articles. First, we can select Choose Database and select Medline with full text. You can see that the Senile Plus will be selected as well. This helps to find more relevant articles. Also, by strategically employing Boolean operators and filters, we can move through this vast sea of information to pinpoint our focus. Understanding how to use Boolean operators, these are words like and, or, not, used to combine or exclude keywords in our search to narrow down or broaden our result. We can start with the concept of mental health disorders and then select the concept cannabis or marijuana with the Boolean operator. And to specify that you are interested in risk aspects, you can include terms related to risk such as risk factors or increased risks. You can also consider adding synonyms for cannabis such as marijuana as well. Use any available filters to narrow down the result based on the publication data, study type or other relevant criteria. Like over here, you can also use advanced search and select from what year you want, mostly in the years of 10 period. This is valid. It should be peer reviewed. journals and authored by experts in this field. And you can select English language. If you want, you can choose the age group as well. And then search. This looks much better. Let's look and find the suitable article out of them. Characterizing heterogeneity in the use of different cannabis products analysis with 55,000 people. Okay, it sounds like it will give us a statistic, which is a good thing. Next, transition to drug co-use among adolescents. It's only going to talk about adolescents, so let's just leave it behind for now. The third one sounds okay as well. Since the video should be no more than 10 minutes, I will not be going in depth about this. For the fourth one, it talks about COVID-19, which is a good thing when it comes to the references, but we have to look in depth of it by at least reading the abstract. The fifth one talks about immigrants, e-cigarettes, also symptoms as well, which we can say it will also can be used. Okay, I have read into these articles and I have chosen two of the most effective. I will explain why I choose one out of these. Both topics are relevant to understanding different aspects of cannabis use and its association with various factors, including mental health. However, if your primary focus is on the relationship between cannabis use and the mental health disorders, the second topic seems much more direct approach. The second topic specifically mentioned the association between exclusive e-cigarettes use and the cannabis use with the mental health disorder symptoms. This suggests a more direct examination of the impact of cannabis use on mental health, as well as potential disparities in dual-use patterns among different population groups based on the immigration status. So, if you are interested in exploring how cannabis use related to mental health disorders and how this association may vary among different population groups, the second topic may be more suitable for your research. Like this, we can use it in others as well. We use PubMed for this case. You go to the pubmed.gov webpage and click on the Advanced under the search, and in the query box you can add cannabis. Then go to the search which is next to it and search drop down and add history. Like this, you can make few synonyms for your concept of exercise. Like mental health disorders, you can add it to the history. Next, we can use this operator AND to combine these search strings for our concept. So go under the action column and add ellipsis and add query. You can see it's been added up here, and do the same for the second, but add AND to it. Then we can add this to our history and then search, and then click on this blue result link so you will be taken to the searches. Then you can use the filter in the left like we did before in Senile to make it more accurate search. Now let's reflect on this journey through the lens of Gibbs' reflective cycle. So diving into all this research was a pretty intense but eye-opening thing for me. There were lots of journals and articles out there, but it is like uncovering a buried treasure once you get the hang of it. It can be overwhelming at first, but each step of the way taught me something new. And let me tell you, having a solid plan for searching and picking apart those articles was the key. This helps you to understand why evidence is so important, especially in healthcare as well. It's like having a flashlight in the dark. It guides us to make better decisions and provide better care. So it is important to keep searching for answers and questioning everything. These are the references I have used, and I have also added them to the description as well. I hope this video is useful and educational for you. Thank you.